A very common thing that I see in my practice is PCOS, which stands for Polycystic Ovary Syndrome. And I think the biggest thing for a patient that's important is to be able to find out that they have this diagnosis so then it can be treated. I have multiple PCOS patients that have problems with getting pregnant. That's typically when they realize that they have it. So if you start your period and it's really, well, it's going to be irregular for a while at the beginning, but let's say you hit your 20s and you're having a really irregular period, or you're not having a period at all, and other symptoms are you have facial hair that's irregular, or you've got a lot of hair on your back or a lot of hair on your stomach, and maybe you're having migraines. Another huge thing is insulin resistance. So you go get your insulin checked. It should, I think personally, it should be around 8, and it's at 35. And the other part of that is you're having a lot of ovarian pain because you're creating cysts on your ovaries. So typically a diagnosis for PCOS is a transvaginal ultrasound that shows polycystic ovaries or cysts on the ovaries, insulin resistance, high testosterone, and hirsutism, which is the medical term for hair in places that it shouldn't be in a female. So that is the diagnosis. I always recommend patients also get their adrenals checked, and I always check prolactin levels as well, because prolactin is being stimulated from the brain from the hormones as well. The other thing that's important to know about PCOS is basically it's the signaling from the ovaries to the pituitary telling which hormones to come out at which time, and that system has sort of been broken. And so you're getting a huge flood of testosterone, and testosterone and estrogen dominance will create the overgrowth of the ovaries to create a lot of this polycystic tissue. So the thing that's important to know is there's lots of answers for PCOS. First off, you see a Western doctor, they're going to put you on a lot of medications. Maybe they're putting you on spironolactone for the testosterone. They're putting you on metformin for the blood insulin, maybe Clomid. I've seen my patients on birth control, all kinds of things. But really, the signaling in the system, in the endocrine system, in the reproductive system is really off. So that's why it's important to know first your diagnosis and second things you can do. Super important with PCOS to make sure you're getting the right amount of omegas. There's also arginine, which is an amino acid that can really help with the ovaries, as well as checking your iron levels is going to be huge. Making sure your thyroid is okay and Hashimoto is also not present. PCOS is never, that's why it's called a syndrome. There's multiple different things that might not seem related that are being caused because the hormone signaling in the body has totally gone cattywampus. And so with my PCO patients, we always start with diet. It's really challenging to treat this on a high carbohydrate, high sugar diet. We use a lot of the ketosis and keto cycling. I don't ever like my patients to stay in ketosis. I want them to cycle out of ketosis and then go back into ketosis. That won't be so challenging once you're fat adapted in ketosis. As well as exercise is so important for polycystic ovarian syndrome, and making sure your nutrient levels are corrected, getting your B12 checked out. A lot of patients will have really high testosterone, so their hair is falling out. They can be really moody because testosterone in females is really hard because it's kind of, you don't want to have a lot of testosterone in a female body. And so it can cause headaches, it can cause joint pain, it can make you really irritable, really angry, and it really gunks up the liver because your body is trying to get rid of all of this testosterone. So that's another thing that's really important is if you think that maybe you have polycystic ovarian syndrome, check with your practitioner, ask for the testing that I had talked about earlier, make sure that everything is ruled out, and that when you go in, that you make sure you talk about diet, nutrient levels, exercise, getting your hormones regulated, checking your thyroid, your iron, and really making sure that you do the whole picture, because PCOS affects the whole body. And so you really need to find a doctor, a functional doctor, an naturopathic doctor that is willing to work with every system in the body, because PCOS will be affected that way. As well as a lot of my PCOS patients have to go through infertility treatment. It's important that if you're going through infertility treatments to make sure there's no Hashimoto in the system. It's also really important to get your B vitamins checked, your zinc, your copper, your selenium, and some other nutrients. So, it's one thing to be able to get pregnant, which is wonderful, but it's another thing to be able to carry the baby long term and have a healthy baby and make sure mama recovers as well. Another little caveat to that is if you are dealing with PCOS and you do end up pregnant, I've seen a lot of success with my patients getting pregnant sooner than later, right afterwards. So if you've gone through IUI or you've gone through IVF and you are pregnant, my best suggestion for you is maybe prepare to get try to get pregnant as soon as possible right afterwards, because it's in the moment where your body's like, oh, I guess I kind of do know how to do this. So the hormones are a little bit more regulated. It's not 100%, but it is something anecdotally I've seen work better for my patients. So PCOS is complex. It's the whole system. Don't just get treated for the endocrine system and the hormone system. There's a lot more to it. Thank you so much for watching our video. Please subscribe below so YouTube knows that you like this content. Ring the bell. Much more to come, and please leave a comment if you have any additional questions or comments. Thanks a lot.